The World Health Organization and governments around the world are taking precautionary steps in an attempt to control the spread of a recent coronavirus outbreak. Major cities around the world are now screening travelers at airports in hopes of avoiding the spread of the virus.
Well, at airports, what it entails is likely to be there's some sort of thermal screening. So looking, these wands which will tell whether somebody has a fever.
An elevated temperature is just one of the symptoms of this coronavirus, as well as a runny nose, headache, and cough.
And at the same time, I would anticipate that there might be questions asked, whether this will be a form that everybody has to fill out, or questions, or whether something's been posted asking, have you recently been to Wuhan? Have you been in contact with somebody? Do you have these symptoms?
And even though each airport may differ slightly in its screening process, at the end of the day, a lot of the onus relies on the traveler.
One would hope, when we're talking about a health issue, that people would be honest. And the more so because if they do have these symptoms, they need to be under medical care.
A woman from Wuhan, China, the city where this coronavirus first emerged, claimed she had a fever and a cough before a flight to France. After taking medication to mask her symptoms, she was able to bypass temperature checks and screenings.
Well, it's as effective as can be possible, short of taking every single individual and doing a blood test. I mean, we can screen for the likelihood of someone being exposed or having come from an area where they might have been exposed. That's the best you can do in 2020.
Dr. Fish says that if a traveler is expected of being exposed to the virus, they'll most likely be quarantined and have tests done to confirm whether or not they are infected. As well, you'll likely start seeing more face masks at airports.
I'm sure you've seen these surgical masks. They're not a tight fit, so things can get in anyhow to your respiratory tract and your eyes are exposed. So the best thing to do is stay away from people who are coughing and sneezing and spitting. Wash your hands frequently and don't put your hands near your mouth and your nose.
The first case of this new coronavirus was discovered in late December of 2019, and until it's contained, we can expect airport screenings to continue.